I'm David Beaulieu, and I'm back with more news you can use. One of our major focuses is brain disorders, behavioral disorders. I don't like the diagnoses. I don't like autistic spectrum disorders. I don't like ADHD, ADD. I don't like anxiety, depression, schizophrenia. I don't like dementia. I don't like to see that because those are harsh labels. And medicine generally doesn't do much of anything for these conditions at all, except drug the people who are diagnosed with these conditions. There isn't anything being done to cure or correct. And our focus is on the very young with autistic spectrum disorder problems and on the aging with dementia-like problems. And so I want to talk to you today a little bit about brain disorders and aluminum. One of the things that I've told people for 35, 40 years, whenever you have a chronic degenerative disease, we see two things happening virtually without fail. Are they the only two things happening? No, they're not. But there are two things that if you address these two areas, you always see a positive outcome. First, there's clinical and or subclinical nutritional deficiency taking place. If you get all of these necessary nutritional items, genuine replacement parts, back into the patient's body heals. And in past videos, I've given you examples of subclinical nutrient deficiency. It's all over. It's everywhere out there. And then detoxification. The average person in this country that comes into my office is carrying a serious body burden, a serious toxic body burden. And their body has to be detoxified. You can't load the body up with toxic chemicals and expect it to function properly. Aluminum is something that we've taken for granted for a long, long time. It's present. It's everywhere in the environment. It's natural. But the body has no specific need or use for aluminum. If you're using aluminum chlorhydrate in your antidepressant, stop. There's a direct relationship between that, lymphatic congestion, and breast cancer. If your husband or your kids or yourself drink pop, juices, or beer from aluminum cans, stop, because the aluminum is getting into the beverages, and very, very little, but a little every single time you do that, it's getting into your body. And aluminum has an attraction for brain. Or maybe we should say the brain has an attraction for aluminum. But it tends to congest there, and it tends to congest there in the areas that on postmortem are related to dementias. So we know that aluminum is a problem, and many of the authorities are really beginning to look at it as a very, very serious problem. If you're doing these things, please stop. Don't cook your food in aluminum pans. Don't cover your food with aluminum foil when you cook it. Remember, aluminum is toxic. It doesn't belong in the human body. It's very handy and very, very helpful. Thank goodness we've got it. From a manufacturing standpoint, it's a wonderful compound. But it's dangerous when we put it in the human body in the amounts that we are. And a little bit later, I'm going to talk to you about aluminum that we're actually injecting into our children. Not very smart. Thank you for your time.